Bladder and Bowel Institute is the world's leading provider of an advanced therapy for bladder and bowel control issues. One of our providers, Dr. Chris Taylor, is going to share with you why we're excited to help you restore control and reclaim your life.
Hi, I'm Dr. Chris Taylor with Bladder and Bowel Institute. Do bladder or bowel control problems keep you from going places or doing things that you like? Are you always looking for a bathroom? Do you have to go too often during the day or have to wake up multiple times at night? Do you get a sudden or strong urge to urinate, then have to rush to get there, or even worse, not make it in time? Well, if so, you're not alone, and you may be suffering from overactive bladder. Now, what if I told you a simple procedure that doesn't require major surgery or significant downtime could provide relief for both bladder and bowel control problems? Now, I'm speaking about a FDA-approved technology that has been proven in clinical trials to be superior to overactive bladder medications. Now, this advanced therapy has improved our ability to treat overactive bladder and has helped over 80% of our patients see significant improvement of symptoms. Bladder and Bowel Institute is the #1 provider of this therapy in the country, and no one in the world has treated more patients with it. Our team of providers includes gynecologists and urologists, allowing us to effectively treat men and women suffering from these issues. We have a Medicare-certified ambulatory surgical suite right in our facility, and our expertise draws visiting physicians from around the country to train with us. And this same level of care and experience inspires patients to travel to our clinic from hundreds of miles away. Now, it's important to know that we're not the only group that provides advanced therapies to treat bladder and bowel control problems. You probably have very good urologists, gynecologists, or colorectal surgeons locally who can treat these conditions. However, patients like you travel from across the country to see us because, for whatever reason, they aren't getting the attention or the help that they deserve. Now, a recent study looked at patients seeking care for overactive bladder symptoms, and 60% of them did not return for their second visit. Over 80% didn't return for their third visit, and only 3% of patients made it through to advanced therapies. So what sets us apart from these practices? Our entire practice is focused on one thing: helping patients find relief from their bladder and bowel control problems. Imagine living life to its fullest again, enjoying things you maybe thought were no longer possible, like taking your grandkids to the park, eating out with friends, sitting through a movie, or just enjoying a good night's sleep again. You no longer have to be a prisoner to the fear, anxiety, or embarrassment. You no longer have to live with these life-controlling symptoms. And best of all, your world won't revolve around the bathroom anymore. Now, we'd love to help you find relief and hope you come see us real soon.
We understand how much these problems can impact your quality of life because we help patients like you every single day. Let's hear from some of those patients. Not too long ago, they too were suffering from these life-controlling symptoms.
I heard about Dr. Taylor through a card advertising a seminar. And since I've had an incontinence problem for so long, I wanted to attend. I did, and was more than happy with what I heard. I was not able to sleep, like every hour on the hour. My world was shrinking because of it. I was getting where I had the time when I went to the store. I could go shopping for about an hour and then make it home. But like I said, my world was just getting smaller and smaller.
I do my dishes by hand. I would go to wash my dishes, turn on the faucet, and immediately I'd have to go, and I wouldn't make it. Sometimes I'd have to change clothes 3 times a day or something like that. And at night, I was getting up like 3 or 4 times during the night and still sometimes not making it to the bathroom. So it wasn't a very pleasant existence.
I was suffering. That's the word I can use, suffering. And I felt like a prisoner, because when you can't make it, you know, to relieve yourself the way you're supposed to, it's just something awful about that. That's no way to live. I would be up all night running to the bathroom like every 2 hours or maybe more. I can remember getting up at least 6 times when I laid down at night. And it was so uncomfortable. And even when I got up, I couldn't hold my water to get to the bathroom. So I'm losing it before I even got there. From the bed to the bathroom, and my apartment is a small apartment, but I couldn't make it.
Seconds before I had to go to the bathroom, I would feel like I had to go right then. And I didn't have much time to make it. I would have embarrassing accidents, no matter where I was, at home or grocery store. But then it started getting so frequent that I didn't want to leave the house. It was a chore to have to go grocery shopping. I didn't want to go to the other end of the store away from the bathroom, or go shopping with my friends, or heaven forbid go to a movie, because I knew I'd miss half of it.
I was even ashamed to go to church sometimes, because, you know, if I was having an episode that I was going a lot, I couldn't sit in church all the way through the preacher, you know, so I just wouldn't go. We'd go out to eat, and I'll have to go to the bathroom 3 times. You know, that's embarrassing. I would be in the yard working in my garden, and all of a sudden, I was voiding down my britches.
I was in the bed. I couldn't drive. I couldn't go get my groceries. Couldn't pick up my medicine, and barely could function.
Over the last decade, our practice has become more specialized because we recognized a huge need in the community for someone to focus on the advanced treatment of bladder and bowel control problems. As we mentioned earlier, Bladder and Bowel Institute is now the #1 provider of this advanced therapy in the world. We're located in Harrison, Arkansas, about 30 minutes south of Branson, Missouri, and we're 100% focused on providing high-quality health care for patients who suffer from these issues. We provide the same advanced therapies commonly found in large metropolitan areas, but we do it with a warm and personal small-town touch. Since most of our patients travel some distance to see us, we understand transportation can sometimes be an issue. So let's talk about the details of our patient transportation program.
One of the biggest barriers for access to medical care is lack of transportation, which can prevent patients from seeking needed medical attention or from seeing the physician of their choice. Now, we have an elderly patient named Mary, who we've been seeing for over 15 years for a condition unrelated to her bladder. A few years back, Mary missed several of her appointments. We learned that she'd had a minor car accident and was no longer able to drive. Now, Miss Mary lives just 2 miles from our office, yet couldn't see us because she didn't have access to transportation. To us, that just wasn't acceptable. So her story has inspired us to create a program that provides transportation to any of our patients who need it. Now, whether you live 2 miles away or 200, we'll pick you up, bring you to your appointment, and take you home. Now, we're required to charge a small fee for this service, and our staff can let you know what we charge for your area. But please remember, if you're our patient or if you've decided that you'll want to be our patient, we can help you get access to the care that you deserve. If there's one thing that I want you to learn from us, it's that you're not alone. Now, when you consider people of all ages, 1 in 6 have overactive bladder, and it becomes more common as you age. By the age of 65, 1 in 3 are suffering from overactive bladder. In fact, more people have overactive bladder than have asthma or diabetes. Not only are you not alone, but help is available. Now, whether you come see us or go see someone else, we want you to get the help you deserve. So don't let your bladder control your life. As some of you may know, not all bladder control problems are the same. There are two common types that we treat: stress incontinence and overactive bladder. Stress incontinence is leaking when you sneeze, cough, laugh, or do some type of physical activity like exercising, lifting, or climbing stairs. It's usually caused by a weakened pelvic floor muscle that creates a loss of support for the bladder. And we can usually fix stress incontinence with a 20-minute outpatient procedure we do right in our facility. Now, the most common bladder control problem that we treat is overactive bladder. Now, unlike stress incontinence, overactive bladder has very little to do with loss of support. Overactive bladder can be defined as a patient having one or more of the following symptoms: frequency, which is going too often, more than 7 visits to the toilet per day. Nocturia is a fancy word for getting up at night to pee. Now, if you're waking up more than once, your body isn't getting into that deep sleep it needs, and you may have overactive bladder. Urgency is that sudden, strong desire to urinate. It's that gotta go feeling. 1 minute everything's okay, the next minute it's the pee-pee dance all the way to the bathroom. And urge incontinence is that same sudden, strong urge that results in an accident. Now, you don't have to have all of these symptoms to have overactive bladder. Any one of them alone may be enough to make the diagnosis. And oftentimes, patients have symptoms of both overactive bladder and stress incontinence. We call that mixed incontinence. Just like women, men can suffer from stress incontinence, overactive bladder, or mixed incontinence. For them, there's another common cause, and that's the prostate. Whether you're a man or a woman, the key thing to remember is that you don't have to know what's causing your problem, because our team of doctors will work through your specific symptoms and create a personalized care pathway that gets you to the therapy that's going to work best for you.
Before we move forward to bladder treatment options, let's touch briefly on bowel control problems. About 25% of the patients we see for their bladders also suffer from similar issues with their bowels. Some of them have accidents because they can't make it in time, and others because they didn't even know they had to go. An inability to control your bladder and bowels can lead to embarrassment, depression, and a lower quality of life. Just know if you're suffering from these problems, you are not alone. And in a few minutes, we'll talk about a therapy that can help get you back to actually enjoying your life. Now that we've discussed all these problems, let's talk about some solutions.
Treatment options for overactive bladder include lifestyle changes, medications, and advanced therapies. Lifestyle changes are actions you can take, like limiting your fluids or caffeine intake, performing exercises to strengthen those weakened pelvic floor muscles, keeping your bladder empty, or wearing absorbent pads to hide those embarrassing accidents. After lifestyle changes, the next step is typically medications. Now, we've relied upon medications for decades to treat overactive bladder. Unfortunately, we just don't see as much success with them as we'd like. In fact, a clinical study showed that over 80% of patients taking these medications stopped taking them during the first year. Most patients we see have already attempted some form of lifestyle changes and have tried and are tired of medications that just don't work well, are too expensive, or have bothersome side effects, and they're looking for a better long-term solution. So let's talk about what works best: advanced therapies. Now, there are 3 advanced therapies to consider. They include sacral nerve stimulation, such as InterStim, medications injected directly into the bladder, such as Botox, and tibial nerve stimulation. Now, clinical trials have shown that Botox and tibial nerve stimulation are no more effective than oral medications. So our practice focuses on sacral nerve stimulation, the only therapy shown to be superior to medications. So let's take a look at how it works.
Advanced therapies, such as InterStim, have drastically improved our ability to treat bladder control problems. And guess what? It works just as well for bowel control. One therapy takes care of both problems. Now, let's learn more about how it works.
To understand how this therapy works, we believe it helps to understand how the normal bladder functions. As the normal bladder fills up, it sends a little nerve signal to the brain, telling you it's getting full. Once in the restroom and ready to empty, the brain sends a bigger signal to the bladder, telling it to empty. The bladder contracts and, almost like squeezing a balloon, the normal bladder empties. Now, for some patients, as the bladder begins to fill, it's already telling the brain that it's full. The brain doesn't give you time to get there before it tells the bladder to go ahead and empty. This overactivity of nerve signals results in a miscommunication between the bladder and the brain, and this is the source of overactive bladder symptoms. The closer you get, the stronger the signal in the contraction, and the stronger the urge. Overactive bladder medications and Botox injections work on the bladder muscle to prevent or slow these abnormal bladder contractions. And for some patients, these therapies work just fine. Unfortunately, they don't treat the underlying source of the problem, which again is that miscommunication or overactivity of nerve signals. Now let me describe this miscommunication another way. I have some hearing loss. If my wife and I are having dinner in a loud restaurant, I have difficulty hearing her. The background noise interferes with our ability to communicate. Get rid of the background noise and I can hear her just fine. This therapy works by delivering a small electrical impulse that blocks out those inappropriate nerve signals, getting rid of the background noise, letting your bladder talk to your brain without that interference, thereby restoring that normal communication. And is thought to work the same way for bowel control. The first step with this therapy is the trial, which allows you to test drive the therapy for 3 or 4 days to see if it works for you. Now, let me describe the test procedure. The test procedure takes about 5 minutes and is done in our clinic. Remember, those little nerves that control your bladder and bowel function live down next to the tip of the tailbone, well below your spine and easy to get to. We look at your tailbone under X-ray and watch as we precisely place 2 little hair-like wires right next to those nerves. No incisions are required. We give you a little numbing medication, place those little wires just underneath the skin, and then tape them to your backside. We connect those wires to a small stimulator that you wear on an elastic belt for 3 or 4 days. Now, if your symptoms improve by at least 50% during the test period, well, it's likely you will do well with the long-term therapy. About 80% of our patients see significant improvement during the test and move forward with a long-term therapy. The long-term therapy is delivered by a small battery and wire similar to the heart pacemaker, implanted just underneath the skin. It's about a 20 to 30-minute outpatient procedure, and we do it right in our surgical suite. We use local anesthetic and just a little IV sedation, so you're comfortable, but you don't have to go completely asleep. The long-term wire is placed in the exact same place the temporary wire was located, again right next to those little nerves that live down by the tailbone. The small battery is placed about an inch or so underneath the skin, in the upper part of the buttocks, below your belt line but above where you sit. And that's it. A small battery and wire. Everything's hidden underneath the skin. No one knows it's there. And it helps you get long-term relief from bladder and bowel symptoms. Since it's outpatient and we do it right in our facility, you go home within an hour or so with minimal recovery. In fact, most of our patients are back to doing their normal activities within a day or so. Over 350,000 patients worldwide have been treated with this long-term therapy, and several thousand of our patients have benefited from InterStim. This therapy has truly changed the way we treat bladder and bowel control problems.
This isn't a brand new therapy. Interstim's been available in the U.S. for over 25 years and has proven results. And it has been shown in clinical trials to be more effective than medications. It has an 84% patient satisfaction rate at 5 years. And remember, only 20% of patients are still taking medications after just 1 year. But don't take my word for it. Let's hear more from our patients you heard from earlier.
I came to get my test procedure and I couldn't believe it. I didn't have to stop from Harrison to Patricia's house in Branson. I didn't have to stop and go to the restroom. I went from going sometimes 25 times a day to 5 times a day. So, this is going to give me my life back.
It's just the best thing going. And when we went, my friend and I went to the seminar that he first gave, and that's where we made our decision to try it because, like I say, I was bound and determined I wasn't going to go on any other kind of medication for it. And to not be able to have to do that is great. I can control when I feel I have to go, I can control it. I can hold it, and I don't have the accidents anymore. And it's just been a godsend to me. I can definitely do my dishes now and turn the water on, and I can take a shower with water on without having any problems.
After this procedure, I could sleep through the night, I didn't have to worry, and it was immediate. And that is the greatest relief ever, the greatest feeling in the world, that it was immediate. All of a sudden, it's like my whole world changed. I not only felt better and had more confidence and looked forward to getting back to my old life, but I could do the things that I wanted to do and felt like I couldn't before, just knowing that I was going to be able to go 6 or 8 hours without having to go to the bathroom. I knew I was going to enjoy taking a walk or enjoy going for a hike, enjoy going to the park with my little girl. You can't even describe that feeling. Just all of a sudden, like the weight had been lifted. This will change your life.
I live in Mississippi, which is a 6-hour drive. Because of the procedure, it gave me my life back. I can drive, I can go get my groceries and my medicine, which I could not do. He's the most wonderful doctor I've ever met, and I've been a patient of Mayo Clinic since 2000. I've seen probably 100 doctors, and Dr. Taylor was the most wonderful doctor. I would recommend him to anybody. His office staff is superior.
When I first met him, his bedside manner was so beautiful. And he was so nice, and he put me at ease right away. As soon as I shook his hand, I knew that he was the one. He's a special person, and he put me at ease about the whole situation. Dr. Taylor's staff, those nurses, the only word I can come up with is awesome. They were sweet. They were really sweet ladies. They treated me very special, and now it's different as night and day. And I love it. It's the best thing that I could have ever done for myself in this life.
I would not have had it done, the procedure done, if they hadn't have did the temporary first. That was what sold me on the whole thing, and I thank God every day that I did have it done. It's changed my life completely. Since I've had the procedure done, like I said, I can sleep 5 and 6 hours at a time now before I have to get up and go to the bathroom, which I haven't been able to do that in over 5 years, probably closer to 10, so. And it was just getting worse and worse, so I would advise it for anyone that has a problem, truly. It's life-changing, it truly is. That I would recommend this to anybody, that it's been a godsend for me. So. But Dr. Taylor has changed my life completely.
So why are patients so excited about InterStim? One reason is the temporary test. You've heard the saying, the proof is in the pudding. Well, the proof is in the temporary test. If you do well during the test, it's reasonable to expect that you would do well with a long-term therapy. It's short, The test procedure only takes about 5 minutes, and the long-term therapy only takes about 30. With both, you go home the same day, usually within an hour or so. It's minimally invasive, which for me equates to minimal discomfort, minimal risk, and minimal recovery. It's proven. InterStim is FDA approved to treat urge incontinence, urgency, and frequency, the hallmark symptoms of overactive bladder. It's also FDA approved for non-obstructive urinary retention and fecal incontinence. It has been shown in clinical trials to be more effective than medications. And over 80% of the patients we test have seen clinically significant results. It's targeted. The reason it works so well is that it actually treats that underlying problem, the miscommunication between the bladder and the brain. It's covered. Both the test and the implant are covered by Medicare, most state Medicaid programs, and almost all commercial insurances. If you have a question about coverage, reach out to us and we can confirm if it's covered for you. It's reversible. Nothing is permanent. We always have the option of turning off the little battery or just removing it altogether. It takes us about 15 minutes to remove, and we do it right there in our in-office surgical suite. It's convenient. Both procedures can be performed in our in-office Medicare surgical suite, providing a safe, sterile environment without having to go to the hospital or go completely asleep. So if you have a bladder or bowel control problem and nothing else has helped, try this 3 or 4 day test. If you sleep better through the night, have less frequency during the day, have less urgency, more time to get there, fewer accidents, well, we can be confident that you would do well with the implant. In fact, about 80% of our patients see enough improvement on the little test to move forward to the long-term therapy.
I hope you enjoyed our presentation. If you have a bladder or bowel control problem and nothing else has helped, pick up the phone and call. Our doctors are available for a free phone consultation to discuss your specific needs. Better yet, take that first step towards relief by scheduling a private in-office visit. We want to be a part of making life better. We hope to hear from you real soon.